So now I'd like to move on to our third panellist, who is Siobhan Campbell, Branch Manager, Quality and Safeguards Policy, NDIS Markets and Safeguards in the Department of Social Services. So over to you, Siobhan, for the third say. Thank you very much.
Thank you, Jane. Hello, everyone. My name is Siobhan Campbell, and I'm joining you from the lands of the Gadigal people of the Eora Nation. I would like to acknowledge the traditional custodians of this land and the traditional custodians of the lands of which you're joining this event from. I'd like to pay my respects to elders past and present and extend my respect to all Aboriginal and Torres Strait Islanders joining this event today. I'd like to thank the NDRP for having me here on behalf of Robyn Shannon, Deputy Secretary, the Department of Social Services. I know Robyn is very disappointed to not be with us today due to a personal emergency. As Jane shared, I'm the Branch Manager for Quality and Safeguards Policy at the Department of Social Services, and I'm grateful for the opportunity to join all of my esteemed panellists for the opportunity to talk about what's needed for better policy. As you are all aware, the Disability Royal Commission found that people with disability are disproportionately subjected to restrictive practices and that these practices can be a violation of human rights. I understand that many people attending today's event spoke to the Disability Royal Commission about their own experiences, and I thank you for your continued commitment to progressing the rights of people with disability. The government understands and recognises that reform is much needed to reduce and ultimately eliminate the use of restrictive practices and is committed to strengthening quality and safeguards to ensure safe and supportive environments that respects the rights and dignity of people with disability. Minister Rishworth earlier today in her opening address referenced that the government's response to the Disability Royal Commission included the announcement of a number of measures that support the reduction and elimination of the use of restrictive practices for people with disability. These measures directly respond to the recommendations that Professor McEwen spoke to today, particularly looking at those parts around data collection and evidence. As we know, these recommendations were informed by consultations with researchers, the disability community, and their loved ones about the use of restrictive practices, including people's own lived experience. Following the Disability Royal Commission, the Australian Institute of Health and Welfare will work with the Department of Social Services, the NDIS Commission, and state and territory governments to improve the collection as well as the reporting of restrictive practices data. This will include the much needed development of consistent data definitions and collection methods on restrictive practices. The Australian Institute of Health and Welfare will be an important partner in ensuring we have a strong evidence base to inform the development of national restrictive practices policy. This work will be staged, and the first stage is focusing on defining the scope of data on restrictive practices within the NDIS and completing a gap analysis on existing data collections on restrictive practices. The Australian Government, in collaboration with state and territory governments, will also establish targets and performance indicators to drive the reduction and elimination of restrictive practices nationally. This first stage of work, similar to the data, will focus on the development of targets and performance indicators in the NDIS and will provide an evidence base for continued reform. These targets and performance indicators are really looking to monitor progress, but also build cross-system accountability on the use of these practices. Following the NDIS review, the Australian Government has committed to working with states and territories to reform the use of restrictive practices within the NDIS. A joint action plan will initially implement national action, and that's looking to reduce and eliminate the use of restrictive practices within the NDIS, but it's also looking to establish strengthened collaboration to progress national action to reform the use of restrictive practices. And we know that that cross-system collaboration is critical to change. As we know, we're not the first people to have this conversation and grapple with the complexity of restrictive practices reform. Claire earlier referred to this as a wicked problem, and we know that cross-system collaboration will be critical in aligning policy and operations across government to ensure that national outcomes on reducing and eliminating the use of restrictive practices are achieved. As part of this national reform, we look forward to continuing to collaborate with the NDRP to identify opportunities for research to support this work. We recognise that safety is one of the key themes that underpin the NDRP research agenda. We're also committed to ensuring and facilitating ongoing collaboration on this important reform for people with disability, their families, carers, peak advocacy groups, service providers, and government. In terms of what's needed for better policy, it is important that there is a national approach, and it will be critical that we work together and strengthen our partnerships and linkages across research, advocacy, all levels of government, and with people with disability to drive much needed change. That ongoing collaboration and support from all sectors will help to ensure the successful implementation of reform that will promote the human rights for people with disability. And before I wrap up, I'd like to thank Poppy for sharing her experience today and highlighting the importance of having choice to have control. I don't think I could say it better than having the right to be respected and treated like an adult. Finally, I'd like to congratulate the NDRP on the first Evidence to Action event and for progressing the development of evidence-based research. This will help shape policies and practices that result in better outcomes for people with disability. Thank you, Jane.
Thank you very much, Siobhan, and especially thank you for stepping in at late notice to be able to present to us today. We really appreciate it.